Government borrowing hit a record £55 billion in May. The cost of supporting jobs and businesses and the plunge in tax receipts means that government debt now exceeds the annual output of the economy for the first time since 1963. And as our business correspondent Dharshini David reports, the government's job may not yet be done.
Making the final tweaks for a new way of shopping. Support from the government meant Astley Bridge Blinds has made it this far, but the owner's unsure if or when customers will be back.
We are basically bracing ourselves for a recession harder than the 2009 financial crisis, which will put a lot of pressure on our profits and everything.
The retail climate was tough even before the shutdowns hit. Government support schemes have tided businesses and millions of workers over. But those helped the Treasury run up a record overdraft last month when public sector borrowing hit £55.2 billion in May, 9 times the £5.7 billion for the same period last year. But for now, the government can borrow cheaply to fund that. And the Chancellor's decided it's worthwhile to save livelihoods.
Everyone's furloughed and everything like that and got mortgages to pay, so yeah, we do think a bit more about what we're spending.
I haven't been furloughed and working from home, but I still think, yeah, like you do think about like the future, obviously.
I just spend whatever. I'm a terrible one for spending.
Venturing out to spend is about feeling safe physically and financially.
More than half of our economy is made up by consumer spending, so keeping those tills rolling will be a crucial part of the recovery. Some say a cut to the VAT rate, currently 20%, could help. But that VAT is a big money spinner for our government. It brings in over £130 billion every year. So it's a tough choice at a time when the government is facing a shortfall, a deficit of perhaps £300 billion because of the crisis.
So to wash my hands somewhere? Yes.
The Duke of Cambridge on his local high street today, as his grandmother, Her Majesty the Queen, sent a message of support to business. But it's more dough that might be needed. The Chancellor's due to announce more measures in July.
Spending now that helps the economy recover is worth doing. But in 3 or 4 years' time, I fear that actually the economy might still be impaired, the deficit might still be pushed up from what we previously thought. And that's when the second part of the plan. Do we need to start thinking about, for example, tax rises?
It's a gamble, but a VAT cut would help the least well off. The price tag for their economic survival may be one the government is willing to take on. Dharshini David, BBC News.
More evidence has emerged of the greater risk faced by some minority groups in the UK from coronavirus. A major study has found that people of South Asian origin who've been admitted to hospital are most likely to die from the illness. Data from nearly 35,000 people found the risk of death for South Asians was up by a fifth compared to that for white people. Our health correspondent Dominic Hughes reports.
The family of Dr. Abdul Mabud Chowdhury have paid a heavy price during the coronavirus crisis. Working on the front line of the NHS meant Dr. Chowdhury, who died at the height of the pandemic, was already at risk of infection. Now it's clear that as a man of South Asian heritage, that risk was even greater.
It's quite terrifying. It clarifies why my dad passed, because my dad was a really healthy, strong, fit man. So the fact that he wasn't able to fight this off, I knew could not have been a fault of his, but a fault on a larger scale, and that larger scale being that South Asians are so much more prone to dying from this virus.
Today's study of 35,000 hospital patients across England, Scotland and Wales found those from a South Asian background were 20% more likely to die than white people. With an average age of 60, they were also 12 years younger. And 40% of South Asian patients had type 1 or type 2 diabetes, compared with 25% of white groups.
Asians and other ethnic minorities are in occupations which are at greater risk. We do need to think about how we deal with ethnicity and pre-existing conditions like diabetes as we ease lockdown, and potentially if other preventative treatments such as a vaccination are available in the future, how those are used.
Higher rates of diabetes accounts for some of the increased risk among the South Asian community, but not all of it. poverty, employment and housing may also play a role. And for these two GPs in Manchester, that leads to wider questions around improving the integration of minority communities into the health system.
Many communities live in a bubble and in effect find it difficult to understand or accept messages that come out from government because there's language barriers or cultural barriers. And it's how we as a wider system make sure that the messages get across, but the messages are also implemented.
The emphasis needs to be also on employers, need to do their risk assessments on their employees, and that covers all aspects of workers, from taxi drivers to people working in supermarkets.
The sense of loss felt by the Chowdhury family is one shared by thousands more. And still, we're discovering disturbing new details about this virus. Dominic Hughes, BBC News, Manchester.
Well, on top of that study, new analysis of deaths from COVID-19 between March and mid-May show that the rate was roughly twice as high for black British men and 40% higher for black women when compared to the white population. Our medical correspondent Fergus Walsh is here with me now. And Fergus, we're now starting to get a true picture of those hardest hit, aren't we?
Yes, Rita, the evidence is really piling up now on ethnicity and risk. Now, these are data from the Office for National Statistics for England and Wales, and they cover deaths in all settings, not only in hospitals, as we saw in Dominic's report, but also in the community and in care homes. So it gives a slightly different picture. And what really jumps out at you is this doubling of risk. Black men twice as likely to die as white men from COVID-19, black women at a 40% increased risk, and Pakistani, Bangladeshi and Indian men at a 50% higher risk. No significantly higher risk for South Asian women. But what really struck me was that these increased levels of risk are after an adjustment has been made for factors such as where people live. Are they in multi-generation households? What are their incomes? What job do they do? Are they key workers? And those risks are still there. So that raises the question why. A lot of uncertainty about that. There was a report commissioned by Public Health England that said long-standing health inequalities and racism were likely factors, maybe deterring many people from seeking healthcare, and that public health messaging simply isn't reaching some ethnic groups.
OK, Fergus, many thanks.